Wait. That's okay.
Oh, John Allen's on.
Good morning, everyone. Thanks for even logging in early. I appreciate it. We're going to give everyone an opportunity to get in, and then I anticipate we will be starting fairly punctually. But for the time being, everyone is going to be placed on mute. I believe that if you do have a question or a comment, you'll be able to unmute yourself. But we're starting off. We're just going to have everyone on mute. I anticipate getting started in a few minutes. Thank you.
Good morning, Ed.
Good morning. If you have not yet already, we have posted to the Suffolk Share portal under the Spotlight section. We've posted an agenda for this morning's meeting. We've also posted a copy of the draft plan, but we may be having some technical difficulties with that. I've got our IT team trying to work on that, but at the very least, if you go to the SuffolkShare.com portal, under Spotlight, you'll be able to see the agenda for this morning's meeting.
Hello? Hello?
Hi, this is Ed Moulton. We're going to be starting in a few minutes. I have this Zoom set to mute everyone, but offer you the ability to unmute yourselves. I believe if you're calling in by phone, you can press *6 and unmute yourself if you'd like to ask a question or make a comment. But for now, we are just going to start with everyone on mute.
Morning.
Good morning, everyone. Thank you for joining us this morning for the first of two statutorily required shared services panel meetings for 2020. If just a couple of quick housekeeping items. First of all, we have the agenda for today's meeting. If you have not seen it already, has been posted to the Suffolk Share portal under Spotlight. Additionally, the draft plan that we'll be discussing, which is really will be a submission of last year's plan, that too has been posted to the SuffolkShare.com portal, also under Spotlight. If you have any issues with logging into SuffolkShare.com, please send me an email, ed.moulton@SuffolkCountyNY.gov. And I will follow up with you and make sure that you can access the information. Again, thank you everyone this morning for logging into this meeting. We will be getting started now. I just want to kick this meeting off by I'm calling it to order at this point, and we will be getting started. To begin the meeting, I'm going to be turning it over to County Executive Ballone, who will be offering some remarks.
Thank you, Ed. Appreciate that. Thanks for your work. I also want to thank Deputy County Executive John Kamen. Not sure if he's on the call yet for all his efforts. And thanks everybody for being on the call this morning for this meeting. I think this will be fairly quick, but this is an important part of the administrative work of the shared services effort. But I think on a practical level, we really saw the importance of shared services throughout as we continue to battle through the pandemic, COVID-19. You know, we've been on, many of the people on this call, we were on calls at the height of the pandemic for months on a daily basis, talking through the challenges and the issues that we faced and working together on those. And I think it really highlighted, if anything, this pandemic has really highlighted the value and the importance of the municipalities in this region working together on the big issues, the big challenges, and even the day-to-day things that affect us all that would allow us to do things more efficiently, more effectively by working together. So I really want to just say thank you to everybody for your continued efforts. We've got good news on the vaccine front. We're working hard on coordinating on ultimately what will be a vaccine distribution plan. That's in the early stages, but of course, the important piece, do we have a vaccine that actually is effective and works? I think we got more good news on that front this morning. So there is hope on the horizon. We're going to have to keep our heads down and keep working at it for a number of months ahead. But we should take this very good news that ultimately we are going to get control of this virus, and it may be sooner than we thought. So again, thank you, everybody. Appreciate the great work. Ed, I'll turn it back over to you and to John, and wish everybody, if I don't speak to everybody, happy holidays and keep safe. Thank you.
Thank you, County Executive. So to move forward with the with this meeting, I just want to begin by asking if we can have a motion and a second to dispense with roll call and declare a quorum. If you would like to make a motion, please make sure that you unmute yourself. Do we have a motion to?
I'll make a motion, Ed. This is Tom Keo.
Thank you, Tom. Do we have a second?
I'll second. It's Matt Miner.
Great, thank you.
Seconded.
All in favor signify by raising your hand if you're on video, or just, yeah. Is there anyone opposed? Motion carries. We will dispense with the roll call, and we do have a quorum. Thank you for that. Right now, we are all together, towns, villages, school districts, fire districts, library districts. So this is an opportunity for an update of, I've asked Dr. Piggott, our health commissioner and leader of Suffolk County Department of Health Services, to join the meeting and provide an update on where we are with respect to the COVID virus, and with working to respond to the emergency. Dr. Piggott, are you with us?
Yeah, I'm here, Ed.
Okay, all yours.
All right. So where are we with the coronavirus pandemic? We are currently at the beginning of a second surge. And it's something that we had talked about over the summer, something that we said, well, let's see what happens when fall gets here. And with the advent of fall, with colder weather in the air, unfortunately, we are seeing an uptick of cases. The brief background on that, we had a pretty good summer in terms of case counts, daily case counts. September was a good month. We were averaging about 50 new COVID cases per day. In October, it started to tick up slightly between 60 and 80 for the first 2 weeks of October, and around 100 per day towards the end of October. What we noticed in the first 5 days of November, we had a slight spike to about 130 cases per day. And then November 6th, that's when it just went haywire. What happened, we started going with daily case counts around 300 or so per day, numbers we had not seen really since the early part of May. And when we had interviewed a lot of these people who were testing positive, what we were finding was, well, we went trick-or-treating for a while, and then all the kids, and they came over my house and we had something to eat. And then we got a few people testing positive a few days after that. Or it was Halloween weekend, we went out to eat and we had a good time, yada, yada. So there was a lot of activity that were related to events that were either private parties or gatherings at people's homes. And these are things that people have been doing throughout the warm weather without any issues. In June, July, and August, people were getting together, eating out, et cetera, and so forth. But a lot of it was outdoors. And at the time, there was not much spread of COVID. So what we're seeing now, the virus is circulating more readily in the communities, and the virus, as we know, loves indoor environments, just absolutely adores indoor environments. And so we are doing our best as a local health department to stay on top of these cases. We redeployed a lot of our staff internally and have the help of some other departments to really investigate people that test positive and try to get to them, make at least a preliminary phone call within that first 24 hours when they contract the virus. And then at that point, we are really trying to elicit those close contacts, because it's really, that's how you prevent the spread, is find out who people who test positive have been in close contact with and get them under quarantine so that they stop the spread of the virus. That's where we're at now. And it's just, that might be our new normal, that we have case counts over 300 a day. Hopefully that gets stamped out, but we have not seen any slowdown of that. As you know, when we have higher amounts of cases per day, eventually it's going to start affecting the hospitals. In terms of hospital census, the month of September, we were pretty much in the 20s to low 30s. In October, the hospitals were in the mid 30s. And around November 1st, we started about 42, but that has been gradually increasing. Now the latest number in the hospitals is 81. That's all 11 911 receiving hospitals in Suffolk County. That 81 is as of November the 14th. And then you're also seeing a slight spike in the acuity of these patients, so that the intensive care units now have 19 individuals with COVID-19, whereas November 1st, there were only 6. So the trends, unfortunately, are increasing. And then the last thing, and the thing we really hurts us the most, is that you're going to have people passing away due to COVID. Again, that always is the last indicator of COVID. It's usually the cases, and then the hospitalizations, and then unfortunately the fatalities. So we've had a couple already this month. Do I have good news? There's some good news in terms of vaccine trials, some preliminary data from Pfizer. First was Pfizer announced that their vaccine in their early data analysis shows about 90% effectiveness in terms of preventing severe symptoms of COVID. Then this morning we heard the Moderna vaccine candidate, also over 90%, about 94.5% effective. In other words, people who received the vaccine did not develop symptoms of COVID, severe symptoms of COVID, in 94.5% of people that received it. Very preliminary data. It needs to be published. It needs to be peer reviewed. And then hopefully there's a vaccine that's safe and FDA approved by the end of this year. And then early 2021, we start working a vaccine distribution plan to get it out. That is really the light at the end of the tunnel. We all kind of hope we just kind of tread water and, continue with our social distancing, our face coverings, and just being careful not to be in areas where the virus can spread, or trying to avoid crowds. Just trying to do these temporary measures until that vaccine candidate is declared safe and effective, until we get a significant portion of the population that has received this vaccine. So it's going to be a rough winter. I wish I had good news in that front, but unfortunately I don't. It's going to be pretty rough around here until we get until a warmer weather again next spring. All righty. With that, Ed, I'm going to just pass it back over to you.
Thank you. Doctor, before you leave, I just want to check and see if there are any questions from panel members that you can answer. Anne, I see you have your hand up. You'll need to unmute yourself.
Okay, thank you very much. And thank you, Dr. Piggott. I am here today as a representative of the Board of Education at South Country Central School District. Do you know if there are any dashboards where you can drill down on infection rates in smaller areas than just the county or other municipalities?
We had a GIS dashboard that was able to drill into townships and also into hamlets. We needed to refresh that. We'll get that back up shortly. I think we took down the hamlet functionality temporarily, but that's available out of the Suffolk County website. If
I could ask whether you would be able to do it by school district as well as the other municipalities.
I don't think we have it by school district. We have it by hamlet, and then it might not be a difficult extrapolation to correlate the hamlet to the school district.
Thank you.
All right.
Do we have any other questions for Dr. Piggott? Great. Thank you, Doctor.
You're welcome.
And so with that, I'd like to move into a discussion of where we are with the Shared Services Initiative. This initiative began in 2017 with the passage of the State Shared Services Law. We completed 2019, our year under our first functional plan. And I am happy to report that we have after speaking with all of our local governments, we have achieved between $10 million and $12 million in taxpayer savings for all of our shared and combined taxpayers through efforts working together. Approximately $2 million of that has come in the way of grant funding that we received from New York State, specifically as a result of our willingness to work together in a shared services format. So let me just try to mute. There's a couple of lines that are still open. Great. So approximately $2 million in grant funding that we received because and only because we are working together in a shared services initiative. One had to do with our police RMS system upgrade, which the Suffolk County Police Department has been, working on with a number of our local town and village departments. There were several $100,000, approximately $700,000 in grants that we received from New York State to develop the shared services portal. We believe that there may be some additional grant funding coming specifically for recycling projects as well, and just highlights the ability that we have working together to obtain grant funding and assistance through a collaborative effort. I know the town of Smithtown and some other local governments in previous years had benefited from a shared services approach. Certainly the town of Brookhaven, with its unique plan with New York State, has managed to tap into available funding for the collaborative shared services approach. Some other areas where we've obtained savings working together. Again, the police department, Suffolk County Police Department, has worked with a number of agencies in sharing our pricing on computer-assisted dispatch technology, as well as a program that will share Suffolk County Police Department computer hardware for significant savings to town and village agencies. The police department and the Suffolk County Sheriff's Office have conducted a number of security assessments for school districts at no cost to the school district. This means that a district that received these services from the SCPD or the Sheriff's Office saved several $100,000 on each engagement above the cost of what they would have paid by engaging someone from the private marketplace, a security consultant from the private marketplace. That's substantial savings by working with the police and the Sheriff's Office. Again, many of our school districts and some of our villages and towns have worked have worked with the county and our vendor to deploy the RAVE system, the panic button system for security measures. We believe that saved in excess of $1 million. We achieved approximately from county government $300,000 in savings through our joint procurement with Nassau County and Westchester County for police vehicles. That was substantial savings, and a number of villages and towns have also taken advantage of that contract as well. Town of East Hampton, along with the Village of East Hampton, Village of Sag Harbor, reported $2.3 million in savings on radio purchases. We've had some other areas of savings as well. I want to give a shout out to the town of Smithtown, which reported 6 figures in savings annually at the end of 2019 by using the Suffolk Share portal, in their procurement process to obtain best pricing on items that they were seeking from the marketplace by price comparison and piggybacking off of the available contracts there. That provided them with substantial savings, and also is an indication of what's possible by using the portal, the SuffolkShare.com portal, which is available to all of our members. We expect to hear back from New York State on matching funds. I would expect by the end of the year, and we'll be reporting back to you when we do. So 2019 was successful. That brought us into 2020. We all are aware that there was a disruption due to not just COVID, but the New York pause orders that came down with respect to non-essential workers and a number of our library districts, villages, school districts certainly shut down for weeks and months, provided significant disruption to our planned activities and shared services. We will be resuming a number of these programs into next year as well. With that disruption also came the ability to work together, as the county executive noted, on COVID-19 response. I want to just report that Suffolk County Fire, Rescue, and Emergency Services provided more than 7 million units of PPE, including masks, gloves, gowns, sanitizer, to our partner local governments throughout Suffolk County in the early days of the pandemic, actually over a period of many weeks, provided on an emergency basis the PPE. I want to say that our Office of Central Procurement, which was created earlier this year by the Suffolk County Legislature, undertook for a master agreement for the entire line of PPE. Again, all manner of masks, both surgical, N95 and other, face guards, gloves, sanitizer, disinfectant, the whole lineup of PPE we have in county contracts that are piggybackable. And I want to thank the local governments that responded to the survey that we sent out on your needs for PPE. We learned that collaboratively or in aggregate, we needed a substantial amount of masks to get us through this pandemic, more than 6 million masks, 100,000 gallons of sanitizer, and hundreds upon hundreds of thousands of units of other PPE. And because we were able to put that together into one solicitation, we received more than 100 vendors responding to the bid solicitation. We entered into contracts with many of them, several dozen of them, to ensure that we always had a vendor, if possible, on board under contract that can provide PPE, even if other vendors in that area ran out of supply. It looks like we are going to be able to maintain substantial supplies through those vendors that are available to all of you and your local governments and districts for the foreseeable future. And it's not just the availability, but I'd like to say that there were some instances where we obtained as much as 88% less pricing advantages compared to what local governments in other regions of the country were receiving at the same time. So working together, we both were able to ensure, number one, adequate supply of PPE, and number two, some substantially lower pricing on the PPE as a result. If you'd like, we sent out notifications at the time the contracts were entered into. If you would like me to share that information with you again, please send me an email after this call, and I will make sure that you have that information on the PPE contracts. A couple of other quick things. We entered into an agreement with Motorola on behalf of 30 fire districts, villages, and the county of Suffolk for emergency radios. We had heard from some fire districts that they were seeking to expand their inventory of emergency radios so that their first responders did not have to share radios between them during the time of the pandemic. In just several weeks, very quickly, our central procurement team was able to put together a bid solicitation, and we awarded a contract to Motorola that provides for discounts of between 25% and 41% on any configuration, essentially, of Motorola emergency radios and pagers. That was a substantial success story on behalf of those who participated. As I said, we did have a number of unfinished items from the 2020 plan that we will be resubmitting in the annual plan for next year, pending approval of the panel. One of them will be, and this is just one example, and then I'll move on, Suffolk Shared University, which will be providing online training and education for municipal workers. I am working with our Department of Civil Service on making available a substantial lineup of on-demand and online training for municipal workers in a number of different areas. And I also expect that we'll be announcing shortly, and this is a request from a couple of mayors that I had, municipal finance training and education that I am hoping we will be able to launch, if not in January, then February of next year, and maintain the ability to offer continuing and continuous training to municipal workers in finance and related areas such as procurement and budgeting. So the full plan itself can be seen at the suffolkshare.com portal under the spotlight section of suffolkshare.com. So with that, I want to pause for a moment and ask if there are any questions or suggestions, comments. Again, you'll need to unmute yourself if you have not already. Everyone was muted to begin the meeting.
Ed, hi, Ed. This
Yes.
is Steve from the Village of Ocean Beach. How are you today?
Steve, doing great. How are you?
Good. Were you able to do anything with that land that the village and the county has?
We're gonna,
Understood.
as soon as I hear back from New York State, I'll let you know. But certainly,
Okay, great.
that is, I believe that's eligible for matching funds. And what Steve is referring to, the Village of Ocean Beach, which is located on Fire Island, was seeking a location for an emergency management trailer that could be located on the mainland of Suffolk County. We obtained permission from the legislature and moved forward with providing a parcel on the grounds of Suffolk County Fire Rescue and Emergency Services for the Village of Ocean Beach's emergency management trailer. For those of you who remember Superstorm Sandy, the Village of Ocean Beach on Fire Island was particularly hard hit. In fact, they couldn't use their village hall for many, many weeks, and maybe even a couple of months. Steve, you would know better than I. So rather than going through a repeat of having the potential for a municipal center that's unavailable, they reached out to us, and we agreed to provide a parcel of property at Suffolk County Freds so that they could locate a trailer for emergency management and municipal services during times of need. So we're moving forward with that, Steve. And again, when we hear back from New York State, I will certainly let you know.
Thank you, Ed.
Any other questions? I do want to say that we continue to work with the Suffolk County school superintendents and school districts, led by the county executive, Dr. Piggott and his team, and others here in county government to assist them and work with them to manage through the pandemic. I think the school districts, working together and working with the county, in some cases, other local governments in the state of New York have done an exceptional job. I believe the health department thinks that as well. And we plan to continue working with school districts in a cooperative basis to ensure that that they continue to meet their mission, as well as comply with best practices and state mandates. One more time, any other questions before I move into our timeline for the 2021 plan adoption?
Ed, I have more of a comment, actually.
Yes.
My name is Kathy O'Hara.
Oh, hi, Kathy. How are you?
Good. How are you? I
Doing
really
okay.
wanted to thank you, actually, because we were short on storage, trying to open up the schools for coming back from COVID, and you were able to find storage for me at Kabreski, which was wonderful. Also, the county provided us with several masks for our students and also a lot of hand sanitizers. So definitely working with the county has been wonderful. And a lot of that is to your credit because you are so helpful to the school district. So thank you very much.
Thank you, Kathy, and happy to work with West Hampton Beach. You've been a very active partner with Shared Services, not just under this plan, but prior to the plan even, being approved at the state level in 2017. A very strong history there. I know that the district does quite a bit also with the village of West Hampton Beach. I think that's great. But thank you for that. So I want to move forward and just discuss a little bit the timeline for the 2021 plan. We have had already, I've reached out to all of our partners. We've had a number of kickoff meetings broken down by government type. There were kickoff meetings with the school districts, towns, the villages. We had meetings for library districts and fire districts as well, all conducted by Zoom. This is our first of two required shared services panel meetings for this year. We don't have an exact time yet, but our second meeting will be on December 18th. Again, that will be held and conducted via Zoom. On November 23rd at 10 a.m., November 24th at 6 p.m., and November 25th at 9:30 a.m., we will be conducting public hearings on the annual plan, and they will be conducted via Zoom as well. The meetings will be noticed in the county's official publications. But if you'd like the information as well, reach out to me by email, and I will give you the public hearing information for each of those three public hearings. Again, they'll be conducted next week via Zoom. Last week, we provided a copy of the draft plan, again, available to you on the Suffolk Share portal. We provided a copy of that to the Suffolk County Legislature. They are permitted 45 days to review the plan and provide any suggestions or comments on the annual shared services plan. So that's where we are. We anticipate things moving a little smoother this year with the meetings because we are able to do them on a virtual basis. I'm hoping that New York State will allow this, moving forward even beyond the pandemic, because it seems to be much easier to reach out to our 109 member local governments and to get together virtually instead of in person throughout this very, very large county. Are there any questions, comments, suggestions before I ask for a motion to adjourn? Okay, do we have a motion to adjourn this meeting?
Motion, Joanne Sharrett.
Thank you. Is there a second?
Yes, Patricia Berger.
Thank you. Is there all in favor signify by raising your hand or putting into the chat if you can. And anyone opposed signify by saying no or thumbs down. The ayes have it. This meeting is adjourned. Thank you very much for your participation, everyone. And we will be in touch with you regarding the details of the December 18th meeting. Thank you very much.
Thank you.
Thank you.